Welcome to Reuters Events Pharma USA 2026. Well, with me, I'm lucky enough to have Thomas Newcomer, Head of US Commercial at Samsung Bioepis. Thank you for joining us today, Thomas.
Thank you for having me.
Let's just dive in with some questions about what you think are the priority agendas that need to be resolved for sustainability of the US healthcare system.
I think it's a easy answer for all of us, and it's to reduce costs. We have to figure out a way to get it to a manageable place for all stakeholders. So it's definitely just, seeing reductions in cost.
And what do you think the role of biosimilars might be in this process?
I've heard many variations over the years of what biosimilars mean to the US market. And no matter what the analogy is, it really is a simple thing with biosimilars. If they're utilized, it reduces cost for all stakeholders and enables the money to be used in different parts of the system. I think that's the best thing about biosimilars to all of us, and full realization that not everybody knows a biosimilar, not everybody, is intricate on all the details of what biosimilars are, but we need to get to that point because whether you're a patient, whether you are an employer who's paying for that patient's health plan or the government paying for it, if you're the hospital system, if you're the pharmacy benefit manager, everybody saves money with biosimilars. So it's a tool that's there right now. If we all would use it and embrace it, then that money gets freed up to use in all the other places that we need in the healthcare system.
Do you think biosimilars are being used as much as they had been anticipated? And what are the challenges that they're facing right now?
It's an excellent question. So biosimilars have been here for 10 years. Are they being used? Yeah, absolutely being used. Probably a little bit of momentum the last two years with biosimilars. We've seen the savings. The savings are over $56 billion in that time frame. So the savings have been significant. But back to your question, are they being used enough or properly? Absolutely not. It's not where it should be in the US market. If myself or any of my colleagues would ask their family, friends about biosimilars, there's probably no awareness of what that is. We need to get to the point where there's awareness of what they are from all levels, like the patient, first of all, and then the providers. There's been great adoption of biosimilars so far in certain therapeutic areas and certain specialties. Oncologists have done very well with biosimilars. Those who treat immunology diseases have done very well with biosimilars. But as we are starting to expand, going after different specialty biologics that are high spend, and you're getting into ophthalmology or rare disease or neurology, they're still at the infancy level on biosimilar awareness. So we need to get better feeling of what this can bring across all specialties from the patient up.
What needs to be overcome in order to get around the biosimilar access issue, particularly in the US?
I think it always starts with who's paying for it or who's managing the prescription.
Yeah.
To me, employers have been left out of this conversation for the initial decade that biosimilars have been here. They can't be. They're the ones paying for it. That starts with the government as well as the largest payer in the United States. They need to be aware of what biosimilars bring to the table for savings for them. And then the people who manage the formulary choices or the medical policy need to put a statement down and put biosimilars in a preferred position over originator products that cost an exorbitant amount of money compared to the biosimilar. We need to start with the biosimilar first to get better adoption.
Okay, big top line question. What do you think are going to be the big top line key trends in the pharmaceutical industry coming up in the next 5-10 years? And how can biosimilars play a bigger role in those trends?
That it is a inverse relationship, I think, as far as an answer to that question. We all know the spend's going to be there. The spend's increasing in US healthcare market. And if you just theoretically think about where these disease states are going and the treatments for them, you're going to have a lot of high price specialty biologics that are coming out to market. You're going to have gene and cell therapy. You're going to have a continuous need to fund money for these advancements. It's awesome. It's great for everybody that there are these scientific advancements, but somebody's got to pay for them. So one way we can pay for them, the inverse to that is biosimilars. We can take the money saved right now and then utilize that money to pay for better healthcare in the future.
Fantastic. Okay, so one big message that you'd like the pharmaceutical leaders here, the stakeholders, to take away at the end of the conference, what would that message be?
Biosimilars save the entire healthcare system the dollars that we need to lead healthier lives in the future. We have to embrace them and utilize them now.
Thomas Newcomer at Samsung Bioepis, thank you very much for joining us today.
Thank you very much for your time. Much appreciated.